Hey guys, it's Mr. V. I'm just taking a look at what we're going to be doing today. We're going to be looking at things that control our rates of breathing. Specifically, I want you to learn about what are the brain areas that are involved in controlling respiration, what can influence our respiratory rate, which we talked a little bit about on Thursday, um, the importance of oxygen and carbon dioxide in controlling that rate, why it's not possible to stop breathing voluntarily, which we've talked a little bit about, and be able to define hyperventilation, hypoventilation, and COPDs. Describe the symptoms of COPDs and lung cancer, and emphysema, um, which is um, one type of COPD or an effective COPD, as well as chronic bronchitis. We're going to skip over lung cancer at this time, and then we'll look at this last learning target a little bit when I return on Monday. Alright, so let's get going here. Let me switch to the PowerPoint. Okay. So when we look at our brain and what controls the breathing, there are really two parts which we learned about earlier when we studied the nervous system. There's the medulla and the pons. The medulla is really the one that sets the basic rhythm, and the pons kind of smooths that out, but the medulla is the main one in charge. When we look at our respiration rates, it's called apnea, silent E. Normal respiration would be 12 to 15 respirations per minute. And then hyperpnea is when you're breathing too fast due to extra oxygen need. If we're to take a look at this a little bit, we have our brain here and the pons and the medulla. And the way that they're able to determine how fast we need to breathe is through actually monitoring the pH of the cerebrospinal fluid. Remember that that's produced by our blood and the choroid plexus of our brain, excuse me. And so the pH of your blood is essentially the pH of your cerebrospinal fluid. And so by monitoring that pH, which is largely controlled by our CO2 levels, that is really what's going to determine our rate of breathing. In addition to this, there is a sensor in the aortic arch that detects oxygen levels in the blood as well. That's really secondary, though, to the pons or the medulla and the pons. In effect, this is going to control nerves, that the phrenic nerve and the intercostal nerve, which is phrenic is going to control your diaphragm, and the intercostal nerves are going to control your external intercostal muscles. Some physical factors that can influence this would be your body temperature, exercise, talking, coughing. You have some conscious control over your breathing, but it can be overridden by your autonomic nervous system at times. And then when we think about like hyperventilation and things like that, if we're having anxiety and things of that nature, those emotional factors can control it as well. So the most important stimulus is CO2, as I was talking about a little bit earlier. So this is actually, you would predict probably oxygen, as would most people, but CO2 is more important because remember, it's the pH of your cerebral spinal fluid that is going to be affected when CO2 combines to make carbonic acid, which we learned about on Thursday. That's going to raise the pH, or excuse me, lower the pH of your blood if your CO2 levels are too high, and so you'll breathe faster. The aortic arch can detect oxygen levels and is the secondary stimulus, but those people who have COPD or these lung disorders, these respiratory disorders, oftentimes have to defer to that second stimulus because they're chronically acidic, because they just don't breathe good when they have emphysema or chronic bronchitis. So if your CO2 levels are too high, you're going to hyperventilate. And so that really means you're going to breathe faster. But when you breathe faster, or you have that hyperpnea, what's going to happen here is you're going to blow off more carbon dioxide than what you would do in normal breathing. And so hyperventilation, you're actually going to lower your CO2 levels really quickly. And so if this is normal, then you get back to normal. But if it's a result of an anxiety attack or because you're really nervous about something, then that can be a problem and you can, pass out. So the solution to this is to put a paper bag over your mouth. When you put that paper bag over your mouth, it forces you to inhale that CO2 that you're exhaling, and so it restores your CO2 levels back to normal. So if you're breathing too slowly, you call that hypoventilation, and this allows CO2 to accumulate in the blood, which would be a normal thing to do, except for a lot of times we can't control that because of some of those emotional factors. So when we take a look at these, COPD, which stands for chronic obstructive pulmonary disease, there are two main things that are involved: chronic bronchitis and emphysema. This is a major cause of disability and death in the United States. My mom, who works with the elderly, has a lot of older people who suffer from this. And a big reason why that is because almost always they have a history of smoking, and they've done a lot of damage to the respiratory system. They become very, very difficult to breathe. They cough, they get infections, and as you can see here, they retain a lot of carbon dioxide, and so therefore they become acidic or have respiratory acidosis. And so they have to default to that oxygen sensor in the aorta for breathing. But this will eventually develop and result in respiratory failure if they develop infections. I want to show you a quick picture, that picture that we were looking at earlier on that learning target slide, before we call it quits here. So if you had chronic bronchitis, if you think about what that means, it's inflammation of the bronchi. And so this would be a normal bronchi or bronchiole. And you can see how they become inflamed and have excess mucus. So it's very difficult to get air in and out of your lungs. And then when you have emphysema, that's really a result of your alveolar membranes breaking down. And so you're having really poor oxygen and CO2 exchange between your lungs and your blood system. So for the remainder of the hour, I would like you to work on the rest of your notes. The topic I just went over was on page 5 and 6, I believe. When I return on Monday, I'll be probably taking a look at a lab, doing that Monday and Tuesday, and then we'll begin reviewing for the test on Tuesday and Wednesday, and we'll probably have that test on that Thursday right before spring break. So I would highly encourage you to finish your notes for Monday. All right, good luck. Have a great day.